Let's test for low back and core control to see if some of these things could be causing issues in your lower back. So this is something I do a lot in my golf screens with patients, but we should have good control of our lower back and pelvis. This also helps with where we should keep our pelvis at with a good neutral posture. We do not want to be fully dumped forward or fully dumped back. A lot of people struggle with this, and some people can't even have control of their pelvis like this. So our first test is just to see if we can rock our pelvis all the way forward and all the way back, creating kind of an extra arch and then kind of rounding our back like this. So to work on this control, we can either do isolated movements just with these ranges of motion, forward and back, or sometimes I'll even have patients do these while laying down. So even in the past, we talked about core exercises. This ties directly into the lower back. When we're laying flat on our back, we don't want too much arch. We want to be able to control our pelvis and keep that in a neutral position and pin that actually into the ground. To see if you're doing this right, I'll tell patients to take a hand, put it behind their back, and see if they can pin their back against their hand and into the table. Even just engaging your back this way will be a workout. Some patients will even ask me what's a good sitting posture or where should I keep my pelvis. And typically what I tell them is while sitting, think about arching your pelvis forward, all the way forward, and then all the way back, and now find a spot right in the center. And in that middle is kind of where we want that neutral pelvis to be for a good posture. If you're struggling with issues with your lower back, come down to Multicare and we'd love to do some further assessment and treatment.